Hi, Surgeon Dr. M. Glani is there, and today I will discuss about the surgical positions, their indications, and how you will made it. So for that purpose, I will turn off all the lights of this classroom. So for your better visualization, so let's start. Position you are seeing on the screen. This position is also known as the Morison position or the lumbar position, and it is most commonly used for the pyelolithotomy. And first patient is lying laterally, and the side to be operated, it is facing up, you can see that. And one more thing, the lower leg should be flexed, and the upper leg, it should be extended like this. And at this point I must consider one important point, that the lower leg should not be flexed more than 50 degree, otherwise there is a risk of deep vein thrombosis. And your both arms, they are placed on the armrest with a pillow between the two arms also, and there is also pillow between both the legs. And in the back, you have to maintain this position with the help of the adhesive tapes, like these ones you can see easily. To show you, that's the Lloyd Davies position, and it is also known as the lithotomy Trendelenburg position, also known as and it is used most commonly for the lower abdominal surgeries. And if you have to perform the APR, abdominoperineal resection, and the rectal surgeries, you will make this position. And in this position, initially patient is lying spine, first thing. After that, the head end of the bed, it is kept 30 degree down, and the angle of the hips, it's almost 15 degrees, and there should be the abduction of the legs are apart from each other, and they are supported on the leg supports. Basically these are the leg supports. And one most important thing, in this position you have to keep the pads just under the sacrum and the other bony prominences, so damage will not be there. And the position of the arms, this should be like this. So this was the final. Well, now the next position you must be familiar with this position, that's the lithotomy position. And this position is most commonly used for the hemorrhoid, fistula, and fissure operations. And in this position, initially the patient lies spine, and after that hips should be flexed at 90 degree, and there should be angle between the leg and the thigh, it should be 70 to 90 degree. And well, it has got three variants. This position is known as the standard lithotomy position. Standard lithotomy position, and its two variants are also there. Now this, if this angle is more than 90 degree, then this position is known as the high lithotomy position. And if this angle is less than 90 degree, like in this case, it is known as the low lithotomy position. And in all the lithotomy position, you have to keep the pads, you can say that, under the bony prominences, so damage will not be there. So this was about the lithotomy, the jackknife position. And in this, basically this position, it's a modification of the prone position, and it is used most commonly for the proctological procedures. And in this position, the legs and the head, both they are lower than the buttocks, you can see easily. And the buttocks, they are just present over the table break, and arms, they are on the arm board, and hands, they are facing towards the head of the patient. And this position is most commonly used for the proctological procedures, and also for the gold standard for the anorectal surgeries. And patient is taken out of this position by first flattening the table and then reversing the order of movements into the prone position. So this was a brief about the jackknife position. This position you are most commonly encountered by this position. This position is known as the cocker position or the rose position, and most commonly this position is used for the thyroidectomy procedure. And in this position you have to remember the four things. First thing, head end, it should be elevated by 15 degrees. You can see that 15 degrees head elevation is there. Then the second thing, you must remember that you should place the head ring under the head, and you should also place the sandbag under the shoulder at the level of acromion process, and hands, they should be tucked to the side in this position. And you place the head ring, just you avoid the lateral rotation of the head, and neck is kept in the anterior position, and the thyroid comes in the anterior position for the better visualization of operability. So this was all about the rose position for the thyroidectomy. Position you are seeing on the screen, that it is known as the Fowler position, and this position is also known as the sitting position or the beach chair position. If you go to the beach, and you can see that the position is like same, and this position is most commonly used for the neurosurgical procedures, nasal procedures, shoulder surgeries, you can see for abdominoplasty, breast reduction surgeries. These are the most commonly procedures which are performed in this position. And in this position, patient is initially kept supine position. After that, the legs are flexed by the 30 to 45 degree, and upper body, it is raised almost 45 degrees. It is the ratio is 30 to 45 degree, its range is there. If it is 45 degree, it is known as the standard Fowler position. And if the angle, if the upper body is raised by 30 degree, it is known as a semi-Fowler position, like this one. And in this case, the head end or the upper body is raised by the 30 degree. This position has got the high risk of the venous thromboembolism, air embolism, and the pressure source in many areas like sacrum, coccyx, heel, occiput, and other areas which are in contact with the table. So this position is to somehow it's dangerous position. So this was all about the Fowler position. If you like our content, if you learned something from our videos, then do subscribe by clicking on the red button below. So thank you so much.